Actually, in this moment, I see three areas that are really working, not theoretically. First, as you mentioned, regulatory intelligence, because this is the most mature and the most under-evaluated. The volume of health authorities' guidances, concept papers, scientific opinions, whatever documents, and it's really impossible for any team, no matter how good they are, to consume and synthesize and to understand everything in real time.
Yeah.
Let's say this part, AI tools specifically designed for regulatory intelligence, and there are some platforms, let's say like Sightline Regulatory, where I recall a good, not so bad actually, from Fryer. For sure, there are a lot of other solutions on the market.
Yeah.
But these kind of solutions can surface relevant, flag new guidances that might affect the portfolio and can be linked to the portfolio.
Yes.
And this has immediate measurable impact on the quality of regulatory strategy.
Yes, absolutely.
I think, in my opinion, this is one of the most important. The second one is the pharmacovigilance, signal detection from adverse events databases, literature screening, summarizing for periodic reports. These are high volume and time sensitive tasks where AI is already reducing dramatically the work of the people, that can reduce workload from 30 to 50% in some documentation implementation. And also has some very interesting developments, because recently they starting to use a common platform for detecting all the adverse events, and sometimes it might be with our monthly or quarterly reports and updates of safety to be behind the health authority about our own adverse events, and another one that actually is really interesting, and I saw very interesting numbers as well, are drafting the clinical study reports. When you can draft and automate the documents, the CSR are one of the most intensive documents to be written in drug development, might be 600, 800 pages, for example.
Sure.
And AI can handle a significant portion of the standard text. The methods, population description, the boiler safety doesn't replace the medical writer, and this is very clear to understand. It transfers medical writer from someone who just typed in someone who validates and to see what is there.